Our focus on women right now is all about your health. What you can do, simple things to be as healthy as you possibly can be so that you're around to take care of all those people in your life that depend on you. And one thing that we're talking about is your diet. And I'm not talking about getting thin so that you can get into a bathing suit or wear those shorts that you like, although that's a nice side effect. I'm talking about the kind of diet that you need to adopt so that you can be as healthy as you can possibly be. One thing when you talk about diet is portion control. And that's what I wanted Emma to address next, is that the size of what we're eating, we might think, hey, I'm eating great, but if we have too much on our plate, it's not doing anybody any good.
There are actual studies on that. Brian Wansick at Cornell University studies that exactly. If we have more on our plate, we see more, we eat 30% more.
Okay.
So there's some tricks for that.
Well, I was going to say, you've brought a couple of different plates. If you can give us an example of how we use the plate itself for portion control.
For portion control, usually you want to make half your plate fruits and vegetables, a quarter of your plate your protein, and a quarter of your plate then the grain, the whole grain.
And that should be in every meal. You should have those three things.
You should have that nice balance, especially fruits and vegetables. Now we're saying you can have up to at least 5 servings of veggies, but I want to see 11 servings, Lynn.
11?
11 servings,
11 servings. Now, I like fruits and vegetables, but I'm not sure I can get 11
Do you want
into
me to tell you how you can do that?
Can you do it really quickly?
I can help you real quick. Breakfast, a half a banana, 1. A cup of strawberries, 2. Snack, an apple. Lunch, have a salad, 4 cups of greens, and throw on some raisins.
Okay.
Then you want to have a little snack in the afternoon, some grapes and cheese.
Okay.
And then let's say for dinner you have some veggies on the side. You have a half cup of broccoli and a few legumes of some sort.
Hey,
you're done.
That wasn't too hard. See, ladies, it can be just that simple. We're trying to make it easy for you. We're also talking about some health issues that you need to be aware of, and screenings and that kind of thing that every woman should have done. We talked about heart disease and, of course, your bone health, but we have to talk about cancer. I know you talked about the screening and family history and that kind of thing, but breast cancer particularly is always frightening to women. Cancers of any kind really are frightening. So what can we be doing in terms of talking to our doctor and getting screened for that?
Right, so during your yearly physical, either with your primary care doctor or your GYN, you'll be getting an annual breast exam by the health professional. But you can also do your own self-breast exam every month. You know, I do have a lot of women who noticed, you know, a lump that they never noticed before, and they bring it to my attention, and then we can go forward with that. And then just making sure you do your mammograms every year.
Okay. And antioxidants, are these things that we can get in our foods, or should we be taking vitamins that contain it? How do we make sure that we're doing everything we can?
I think food source is a great source of antioxidants, and they're doing more and more research to see exactly what their role is in preventing cancers, but they do know that it's an important thing that you can do.
Also weight control, right, Dr. Ray?
Right, exactly,
It's
for
a huge
certain
thing
cancers.
For certain cancers now.
Because
So what's considered to be an antioxidant when it comes to food?
When it comes to food, antioxidants are in fruits and vegetables.
Oh, okay.
And so they're cancer preventing. You also have other things called polyphenols. These are all good for you. And indoles and fruits and vegetables can save your life.
Okay, so those 11 servings that you listed for us earlier can be our antioxidants and be helping us fight cancer.
Right. That's
There's another reason. Not only will you be thin and healthy, but you'll be fighting cancer.
And wine, too. Can we talk
Wine?
about wine?
Can we talk about wine? What's taking us so long?
Those red grapes have also, you know, heart-healthy factors in the skin of the grape. And I noticed that we're allowed to have 1 wine or 5 ounces of an alcoholic beverage as women, and men get 2. But 5 ounces
Go back to that gender equality thing that we talked about earlier. We always get the short end. What about vodka? Oh, I digress. Okay. All right, very quickly, we're almost out of time. One thing that women hear about all the time these days is metabolism. And I don't know about you, but it's slower and slower and slower. What role does metabolism play in your body and your health?
It plays a huge role, and it actually doesn't have to be age dependent even, because a lot of times if you're staying with the exact same exercise routine for months and months and months, you will reach a plateau because your metabolism has adapted to your workout. So trying to change things all the time, your exercise routine, being consistent with your diet. And this can be when you're in your 20s and 30s, or even when you're in your 60s and 70s.
And when you get those good habits early on,
Right.
or you develop them whenever, if you keep up with that, it
Right.
really, it does pay off. So in terms of food, we're almost out of time, but any kind of little secret diet
As far
tip
as
you could
food,
give
you
us?
know, I would say keep away from white flour, white sugar foods, get whole grains, lean meats, tons of fruits and vegetables. And, you know, legumes is something we don't even think about. Eat fiber to feel full. It's a
Okay.
wonderful thing.
Okay, and we should always eat meals, we should not skip.
That's correct. Eating every 3 to 4 hours is the best mantra.
And if we adopt these good diet habits, then things like that we didn't get a chance to talk about, but diabetes and high blood
Right.
pressure and all that, that can be positively influenced as well.
Absolutely. And it can help control obesity, which can also lead to diabetes and high blood pressure.
Oh, great advice. Okay, I don't know about you, but I am inspired. I always try to be a good role model and eat all the right things and get my doctor's visits and have my mammogram and all that. So I encourage all of you to do that as well. Thank you so much, Dr. Ray
Thank
from
you.
Cooper Hospital. Great to have you here. And Emma Folk. Great advice.
Thank you.
Hope we all get into that bathing suit this summer and be healthy. Listen, next time, join us as we sit down with Tanya Young-Williams. She's the wife of the former NBA star Jason Williams. He's now in jail. She's going to tell us her story. We'll see you then. Thanks.